Hi, everyone. Thank you for joining us for this Scoliosis Research Society podcast. My name is Joseph Osorio. I'm a neurosurgeon from UC San Diego, and I'll be leading the podcast. Today, it's an episode where we'll be featuring the Walter Blount Humanitarian Award winner and the Lifetime Achievement Award winners. Today, I have the pleasure of being joined by Dr. Charles Johnston and by Dr. Richard Hodes. Thank you for joining me, Dr. Johnston and Dr. Hodes. I'm going to quickly do a brief few questions selected to each individually of you, and then I'll have a couple of questions, which I'll open it up to both of you to give some comments. Well, Dr. Johnston, you've had a remarkable career spanning decades at the Texas Scottish Rite Hospital. What motivated you to specialize in pediatric orthopedics, and what has been the most rewarding aspect of your work with children?
Well, if you go back to 1976, I graduated from Columbia College of Physicians and Surgeons as a med student. And during my fourth year, I was stimulated by a senior resident and by the chair of the orthopedic department at that time, Frank Stinchfield. And they basically told me as a fourth year student that I was designated as an orthopedic surgeon, and that if I did anything else, it would be a mistake. So that's how it got started. And then my internship year in San Antonio, I met a very important former POSNA president, Kay Wilkins, who, as the pediatric orthopedist in San Antonio, also basically told me, I think this is what you should do. And so I was basically channeled into pediatric orthopedics, and the spine part of it occurred more or less as a fellow at Texas Scottish Rite Hospital in 1981, where I was influenced by Tony Herring and Dennis Wenger. And I had the opportunity of meeting Eduardo Luque. And so the spine part of it sort of naturally grew from my overall interest in pediatric orthopedics. And that's how it all started. And the rest is history.
That's wonderful. Thanks for sharing that. I feel like mentorship is always such an important part of all of our careers, and it's wonderful to sort of highlight those important people that have been so influential in your career. I'll transition over to Dr. Hodes. You've worked extensively in underserved populations in Ethiopia and in other countries. Can you share a particularly memorable patient story that highlights the impact of your work?
Yeah, that's actually pretty easy. So I've been a doctor in Ethiopia. I graduated from medical school in Rochester in 1982. I'm an internist. Okay, so I've never done training in either orthopedics or neurosurgery, and I had no plans on doing anything except internal medicine. But in 1999, working at Mother Teresa's mission here in Ethiopia, I met two abandoned orphans with TB of the spine. And I knew that, first I treated their TB, and then I realized they needed to get surgery. And if they didn't get surgery, they would have a high chance of becoming paralyzed and dying quite young. So I didn't know what to do. And I asked the Almighty what I should do. And he actually sent me a message. And I ended up adopting them, adding them to my American health insurance, bringing them down to Texas Scottish Rite Hospital to Steve Richards and Dan Sucato, who operated on them and saved their lives. Of those two, one of them is now a pharmacist in New Mexico, and one of them is now a businessman in Ethiopia. Another guy came along, and I did the same thing, and I adopted him and added him to my health insurance. And it was Dan Sucato operated on him as well. So my first three spine patients I legally adopted, knowing that I'd have to spend the rest of my life with them. But just to give you one other example, and they're doing fine now. Just to give you one other example, several years ago, I had two young men who walked into my office, and and this happens all the time. The older brother said, "I brought my younger brother here." The older brother is a 30-year-old Ethiopian priest, and the younger brother is about a 20-year-old. And he said, "I'd like you to help my brother." And so I was writing down, my assistant had stepped out of the room, so I was doing the intake and writing down their names and their addresses and their phone numbers and all of this stuff. And then I looked at their shoes and I said, "Yeah, your shoes are in bad shape." And they said, "Yeah, we walked here." And I said, "You walked from the bus station? That's 8 miles away." And they said, "Oh, no, no, no. We didn't have $20 to take a bus. So we walked 250 miles from Gojan, from Northwest Ethiopia." And I said, "Where did you sleep at night? Because you can't sleep outside in Ethiopia because there are hyenas that can attack you." And he said just the simple phrase, "Xavier Engeda," which means guest of God. Now, I understand what he was just saying is guest of God, but what he's describing is a whole hospitality system in Ethiopian culture, where in the highlands, you can knock on a door and say, "I'm a guest sent to you by God, please let me in." And strangers will let other strangers in, give them a place to sleep, cook them a meal the way you would cook a guest, wash their feet, and show them out in the morning. And they did this 8 nights in a row. And then I said, "Well, where are you staying in Addis Ababa?" And they said, "We don't know. We just got here." And I said, "Okay, you stay at my house." So they both moved into my house for a while. The brother, I gave him money so he could take a bus back to his family. And the younger one stayed with me for a while. He ended up going to Accra, Ghana, and getting surgery with our partners at Focus Hospital there. And that guy is now a tailor. And then during COVID, he opened up a mask factory in my house, taking one of the rooms. We got him a sewing machine, and he was sewing masks, and he gave us half the money that he made selling the masks so that we could use it to help other patients.
Wow, that's remarkable. That's just remarkable. You know, it's interesting because I think it's through both of your shared stories, it's either the mentors that we have and the patients that really drive the inspiration, I think, to keep us going and really to create such an amazing career, which both of you have obviously had. Dr. Johnston, I'm going to pivot back over to you. You've published extensively in peer-reviewed journals. Can you share insights from your most impactful research and how it has influenced pediatric orthopedic practices?
Wow. I guess the most impactful research that I would probably talk about is the biomechanical research that we did in the mid to late 80s, where a lot of the anchoring mechanisms, the stress strain relations, the rigid versus semi-rigid type of anchors, many of the sort of variables that we take for granted now in our established techniques were all being kind of worked on in the mid 80s, when we had a changeover from, for example, the original Harrington type instrumentation to the sublaminar segmental instrumentation of Luque, to the more nuanced and a little more scientifically worked out techniques of deformity correction that were pioneered by people like Cottrell and Dubuisset. So taking all of those sort of systems and methods, I had an engineer partner named Richard Ashman, who I met in New Orleans in a brief period of my career where I was at LSU. And the two of us really actually Ashman was really the main person, but the two of us worked out designs for a locking mechanism, which included an adjustable sort of eye bolt tensioning device. And it eventually became the TSRH instrumentation, named after, obviously, Texas Scottish Rite Hospital. And that was a system that was widely used in the 90s, and I think established many of the principles that, as I said, nowadays are pretty much taken for granted in terms of segmental rigid fixation, pedicle fixation, and all of the techniques to correct the deformity. So that's what I would point to, I guess, as the thing that I would say maybe is my important contribution to spine surgery.
That's wonderful. Gosh, that historic perspective is it's incredible to hear because, being myself sort of on the earlier phase of my career and hearing about TSRH, it's always inspiring to hear how that came to fruition, especially having that partnership as a surgeon with another engineer and seeing those systems evolve. Dr. Hodes, I wanted to pivot back to you. Your partnership with Dr. Boachie and the FOCOS has been significant. How do these collaborations enhance the quality of care provided to patients in need?
Oh my gosh. Well, when I started our spine program in 2006, I met Dr. Boachie around Christmas of 2005, and we decided to start working together. And at the time, he was still in New York, so he would come to Ghana with an international team of doctors. And we made plans in the spring of 2006 for me to send several patients. So that year, I officially started my spine program based at Mother Teresa's mission, and we got 20 new spines, and we did 11 surgeries at Focus. So we sent 5 people with 1 staff person, and they had successful surgery by Dr. Boachie and his international team. And that got us started because there was no spine surgery at all in Ethiopia at the time. And so that year, we actually did 11 surgeries in 2 groups at Focus. And then we kept on doing surgeries for years. We're still doing surgeries, especially patients needing long-term halogravity traction, because we've used that for up to 7 months in patients. So we can get perhaps a 50% correction in the spine deformity that way to make it easier on the spinal cord. And the TSRH people are instrumental in inventing that. So I want to thank the TSRH people for their wonderful work. And now I'm also partnering with Dr. Rajasekaran in India, and we're doing both training of surgeons, and we're doing some surgeries in India as well. And we have people from America coming and operating here in Ethiopia. And then we also have Ethiopians who have done fellowships in India, and they're coming back and they're doing surgery. Just yesterday, my neurosurgery partner showed me a case where it was a simple adolescent scoliosis, but he had a wonderful correction. And 5 years ago, this could never have been done in Ethiopia, but now for the first time, we're doing scoliosis surgery here in Ethiopia as well. I'm in clinic today. It's just a random day, and we have 9 new deformity patients, and these are some of the worst deformities in the world. I'm just starting, but I have an ankylosing spondylitis. I have congenital scoliosis. I have idiopathic scoliosis. We haven't seen any TBs yet, but we may well have 1 or 2 TBs waiting in the waiting room as well.
Wow, that's remarkable. We're towards the end of our podcast, and I do want to wrap it up with one question for both of you. It'll be the same question for the both of you, but Dr. Johnston, we'll start with you. Looking back, what advice would you give your younger self at the start of your medical career?
Well, I guess the message is that every patient is obviously unique, and the most important thing is to establish a diagnosis and establish a relationship. Because if you are going to undertake a corrective surgery, for example. I think that the importance of knowing everything you can possibly determine about the condition and the etiology and the possible, complications. In other words, the whole gamut of medical and surgical knowledge for that individual patient. This is the best way to serve your patients, do the right thing, and have a high chance of success.
Wonderful. That's truly a pearl and inspiring, and definitely for the next generation. That's certainly something that I would definitely echo. Should be an aspect that should be looked through as they establish their career. How about you, Dr. Hodes? Looking back, what advice would you give your younger self starting your medical career?
Well, I would say have an open mind, because I never intended, I'm an internal medicine doc, and now I have a full-time severe spine deformity practice. And I've evaluated over 5,000 spine deformities with 9 new patients just today. So I would say have an open mind and be willing to learn. And don't say like, well, I'm an internist, I can't do this, because I mean, it's, with all due respect, and I mean this, it's not rocket science, and I can do the medical aspects of spine quite okay at this point in my life and my career. And I've had great mentors. I mean, I've spent hours and hours at Dr. Boachie's side with patients. But keep on learning, and you can do lots of great stuff.
Oh, that's wonderful. That's wonderful. Yeah, having an open mind, because sometimes you don't know which way life will sort of take you. And I think if you have an open mind and you're excited about your career, certainly the opportunities are vast. Well, thank you so much, both of you, for joining me today in this podcast. It's been great getting to know both of you and getting your insights and your perspective after having such wonderful careers. And thanks again. And I hope all the listeners will enjoy your perspectives, and have a wonderful day.
Thanks very much for having us.
I want to invite you both
right.
to visit here in Ethiopia.